My name is Sandra Perillo. My husband is Thomas Perillo. Tom and I met in high school. We were together in high school, through college, and then got married a year after college. He's the kind of man that everybody would love to have as a husband, as a father, as a friend, very gentle man, loving, kind. I can't say enough good things about him, and I still love him. He was diagnosed with Parkinson's in 2012. He managed to function. I mean, you know, we went to all the fairs, and then I guess it just started to progress. And sometimes you don't realize that it's progressing. You know, you just sort of take their actions as normal, or maybe getting older because he forgot. And then it just sort of went downhill a little with the agitation. And then at the very end, before he was admitted, he was combative. And that was very disturbing. Tom is a very gentle man. And the one night, he was just flailing with his arms, which sometimes Parkinson people do that. And then I turned and he hit me. And with that, I called my daughter. And she came up and there was just, I just could not get through to him, could not penetrate that, you know, I was trying to calm him down. And we took him over to Chilton, and from there he was transferred to Ramapo Ridge, which was exactly where he had to go. I have never been as content to know that he was there. They were wonderful. I really can't say enough good things about him. The nursing staff, the aides, the doctor, everyone was just understanding what I was going through and understanding what he was going through. Some days are better than others, you know, which is human nature. And if he has a good day and I leave, then I feel good. But if he has a bad day and says, when am I coming home? I don't feel that good. But, you know, I realize this is where he has to be. It's a hard decision, very hard. The toughest part is not having him at home. After 61 years and going out since we're 17, I miss him. I think of 100 ways, can I take him home and handle it? And I really can't. You know, spoken to the doctors and spoken to Dr. Gilman, who was just wonderful in explaining different things, and I feel that this is where he needs to be. I mean, I'm leaving the love of my life here, and they're taking care of him.
Christian Healthcare Center is a unique place, I think, where people during a particularly vulnerable time of their lives, which is illness, can come and be lovingly cared for in a comfortable and a really beautiful setting. That's how I think of Christian Healthcare Center. It's a very mission-oriented place, and I've been struck with that ever since I arrived, from the first day I arrived, and I think it permeates the institution, and you can just see it in the actions of everyone who works there.
What goes on behind the scenes in a physician-patient or therapist-patient interaction often goes on software and hardware and computerized records that require incredible integration. And Atlantic Tomorrow's office has been a wonderful player and partner in making that as seamless as it can be.
As a healthcare organization, we want the healthcare that we deliver to be at the highest level, to be delivering excellence. We understand that it's not about us as individuals, but it's about what can we do to better serve those who were working alongside us and who are coming to us for care. At the highest levels of Atlantic Tomorrow's office, Larry and Bill and others, we've seen the way in which they embrace service leadership, that they want to be known as the best at what they do, but in the end, they don't want people to see them as individuals. They want to see and be blessed by the impact that they've made, personally and professionally.
One of the mantras that we pass along to our customers is to standardize, automate, and drive efficiency. And as you know, anytime you can do that, you can lower operating costs and become better at what you do. Christian Healthcare has truly embraced that concept, whether it be digitizing the documents and creating workflow within the electronic medical record system, working with IT in terms of making sure, especially in today's climate, that your data is safe, secure, most importantly, compliant. But once again, Christian Healthcare has truly embraced all that technology.
If you walk around this office, if you look at all of our marketing materials, it's all obsessed with customer excellence. I mean, you deliver that through your staff, through your physicians. We deliver that through our technicians, through our customer service representative. I mean, it's just a parallel that is so similar in what we want to be known as.
Bill and Larry, I can tell you when they first came to Hackensack University Medical Center's Joseph M. Cesare Children's Hospital to talk about the Jillian Fund, their passion and their commitment to the mission of the Jillian Fund was evident, and I think that is really admirable and comes through in everything that they do. You know, sometimes what happens is organizations start out with the best intentions and then they kind of fall off. But I can tell you that because of Larry and Bill, their commitment has been sustained for many years, and I believe for many years to come.
Much like the culture at Atlantic and Christian Healthcare of being obsessed with excellence, we're both very innovative, and I think that is shown in how we approach both of our businesses and services. As Christian Healthcare has grown over the years, so have we, and our relationship from a technology standpoint has grown. Anything innovative that we have come out with, Christian Healthcare has truly embraced, and I believe that's what has helped Christian Healthcare stay ahead of the curve, not only from a technology standpoint, but also from a patient care standpoint.
There are lots of employees here, and they see some of the charities that that we support, and it relates. I mean, they have a family member that needs a kidney transplant, or they have a senior that needs to get into a facility that needs the services that like companies like CHCC provides, and that makes them feel good about being part of Atlantic.
During the last 10 to 15 years, and perhaps even longer, that Atlantic Tomorrow's office and Christian Healthcare Center have been journeying to find and to understand and to harness and utilize how innovation and technology can make a difference. We found that there have been a number of similarities between us that have enabled us to work together so well. Atlantic Tomorrow's office had very humble beginnings. They initially started in their journey focused on office copiers and other types of similar equipment. But today, their breadth of expertise spans across the entire area of the way in which innovation and technology and equipment can be a part of enabling organizations like us to be at the top of our game.
Christian Healthcare Center's contribution to the community, I think, is evident in how it has continued to grow and both physically and also make adjustments to the changing medical world that we live in.
Bill and I actually grew up in the same town, Vernon Township, and we were connected through a mutual friend several years ago, and it was great to see such a wonderful person from my hometown do so well, but also never forget the fact that we're all here to serve human and mankind.
The Christian Healthcare Center medical staff is just an awesome and outstanding group of women and men. They are so committed to their profession. They love what they do. They provide an incredible example of the fact that it's about the people we serve, and it's understanding them. What are their physical, emotional, and spiritual needs? Who are they as an individual? And how can we be a part of enabling them to experience health and wellness?
I've been here for the past 11, 12 years, and I came from a different hospital, and after I came here, I found out that the level of dedication was absolutely at a different level. The way they cared for the patient, the empathy and all, I had not seen that level of empathy being provided to the patient the way it was here. So I started working here, and I'll give you a small example. At the other hospital, if a patient is discharged, he's sent home, and that's the end of the story. Out here, the family is contacted, the patient's treating psychiatrist is contacted, and we go to the highest level of making sure that safety comes first, the patient gets better, and he is provided with all the care that is needed.
When you approach a patient, you really need to come from a caring place. And it's easy to say those words. It's hard to really do that. But there is a culture within the Christian Healthcare Center that brings that out in all the physicians, brings it out of myself. And I must say that that is really different from how I found it in other settings.
We work as a team. It's not an individual effort, it's a team effort coming from all the physicians from different fields like surgery, medicine, cardiology. The psychiatrists are always there, the social workers are always there, and it's mainly the teamwork that helps.
Our medical staff represents over 70 physicians and other allied health professionals that come from a diverse array of areas of specialty. Those that we serve often present a very comprehensive set of needs that we are caring for across the continuum of physical, emotional, and spiritual needs. That requires that the medical staff has a very distinct and clinical depth to it, that there are many specialties that are represented. So as we're looking to deliver excellence, our physicians, who may very well be internists, family practitioners, psychiatrists, can call on other areas of expertise to help us to treat the whole person.
Dr. Nanjiani is the president of our medical staff, and he does a wonderful job in terms of making sure that our medical staff is happy, providing them with the tools that they need to do what they do. Now, I must say that Dr. Nanjiani has a fairly easy job at it because the people that we have on our medical staff they're wonderful physicians. They really don't need a lot of direction from Dr. Nanjiani or myself. So I want to really applaud them because they are the ones who make the center what it is from a physician point of view.
Healthcare is a team sport, and while there are certain individuals that always stand out and do special things, it's really about the sum of what the entire team does. So I think that it's really just an incredible opportunity to honor everyone when Christian Healthcare decided to honor the entire team of physicians and medical staff.
My history at the Christian Healthcare Center goes back about 12 to 15 years, and my husband has been on staff here, and my children have attended the daycare center, as well as my father-in-law, who has been a patient a numerous amount of times in the past 4 to 5 years. My father-in-law was generally a healthy man until he was diagnosed with a cardiac aneurysm and had multiple surgeries to put stents in. Although on top of that, he had a condition called orthostatic hypotension. So he was a difficult patient to try to manage. The deciding factor to having my father-in-law cared for at the Christian Healthcare Center was that my husband refers a lot of his patients here for physical therapy, and the outcome and everything the patients would say were always amazing things. And we wanted to make sure he was placed in the same environment. He was taken care of so well that he would comment that the nursing staff and the assistants and every single person that entered his room cared so much about him, his comfort level, if he needed anything. It was like he was home with constant care, and he enjoyed his time here. I think he enjoyed it so much that we would come and he would just always be sitting up, smiling, so well taken care of that it was easy to know that we could walk out the door and he would be okay. As I would watch my husband interact with his father, the love was just so unconditional. I've never seen a father and son so close, that it was so much love. And that was also hard to watch. My father-in-law getting sicker and knowing the end was coming. Although they had a great, great relationship. We just lost him. He went home to be with the Lord, but he was a very special man. I was very close to him. Anyway, it's so hard to talk about him. It's only been 7 weeks since he's been gone, but he was my best friend as well as my husband's best friend, and I miss him. I feel like the entire medical staff that is honored all deserve it. I feel like it's a joint effort when you're in a big facility like the Christian Healthcare Center. An orthopedist needs a general practitioner. The general practitioner needs the rheumatologist. It trickles down from one to the next, and they are all such great blessings to this facility. They are amazing leaders as well as physicians. They all deserve to be honored.
The Christian Healthcare Center medical staff is a very diverse team. Their diversity is reflected in who they are as individuals. It's reflected in their areas of expertise. And as a diverse team, personally and professionally, they provide incredible leadership to the entire organization. As an organization seeking to provide health, healing, and wellness to those we serve, making clinical decisions, understanding the needs of those we serve, pulling together a team from many different disciplines is so incredibly critical. The leadership that the medical staff provides in the midst of their diversity makes such a tremendous difference and enables us to see that the mission and vision of the organization is alive and well and visiting itself within the needs of those that we serve. When I look at the contributions of our medical staff in clinical decision and in bedside care to those that we serve, and I see how Atlantic Tomorrow's office has provided us with the tools and resources that we need, with a focus on those that we serve to make that happen. That is such a humbling experience. I can't think of a stronger word than just humbling, to be able to witness that and to see that. And so it's so heartwarming and so affirming to see that we are celebrating and recognize these two honorees this evening.